Over the last 10 years, the occurrence of concussions has been on the rise. Statistics Canada reports out of all emergency hospital visits among 10 to 18-year-olds, 39% were estimated to be diagnosed concussions and around 24 were possible concussions. One rationale is that contact sports have been known to put athletes at a greater risk for these injuries. It was reported that there has been a 40% increase in head injuries in sports including football, hockey, and soccer. When it comes to concussions, it's important to understand what they are, but also look at the whole picture. Scientifically, concussion can be defined as a complex pathophysiological process affecting the brain induced by traumatic biochemical forces. Simply, they are caused by a direct blow to the head or a sudden bodily movement that rattles the brain. Because of their nature, concussions are often hard to detect. Concussions can be determined by a number of differing symptoms. Each concussion may produce a unique set of symptoms for different people or even for the same person. Some symptoms to look for include headaches, dizziness, confusion, disorientation, and nausea. A common misconception is that for an individual to have a concussion, they must go unconscious. However, this statement is false. Initial diagnosis and management of a concussion is important because it can help reduce long-term discomfort and prevent secondary effects. A large issue with this injury is that symptoms may not present at first, but will develop even hours or days later. Currently, there is lack of evidence supporting many of these treatment strategies. Often, doctors recommend plenty of rest, avoiding the use of electronics, as well as participation in both sports and any strenuous cognitive activity. Another misconception is that doctors typically advise patients to abstain from all activities entirely. However, there is evidence to support that this could lead to greater risk of long-term deficits. Generally, an athlete must be cleared by a medical health professional in order to resume play. Like most aspects of concussion, standards of eligibility in this regard may vary. One guideline for return to play used at the University of Toronto states that in order to get medical clearance, a player must have no symptoms at rest and remain with no symptoms during exercise for a designated testing period. Symptoms normally resolve with 7 to 10 days of injury. However, this is subject to individual variation and can be affected by factors such as sex and concussion history. In a 10-year study conducted at McGill University, it was determined that males were not able to resume play until roughly 11 days post-injury, while females had to wait around 14 days. Another finding from this study showed that the time to play increased with each time the player was diagnosed with another concussion. As we mentioned before, symptoms can last for a long time after the injury has taken place. One study examined athletes on the basis of both the number of concussions they suffered and some cognitive variables. These variables included verbal memory, visual memory, reaction time, and processing speed. Results of the study show that athletes that have suffered 2 or more concussions performed worse on tests that focus on both verbal and visual memory. Another study compared those individuals who have suffered these types of injuries to individuals that have not. Findings showed that total symptom scores in individuals with 2 previous concussions were more than double the scores of those that had never suffered this injury. In other words, increasing number of concussions increases the severity of reported symptoms. These findings suggest that the effects of concussions can lead to long-term cognitive decline. One thing we haven't talked about is if this type of injury can be prevented in any sort of way. Helmets are one prevention method that is required for individuals playing both hockey and football. In addition, mouth guards are recommended for athletes playing these sports but are only required in some organizations. A large issue with concussions is the influence of self-report and the lack thereof. These reports can be inaccurate, and many athletes fail to report their injuries in fear of not being able to play. Another issue lies in the physical changes in the brain and their persistence even after symptoms disappear. These imply long-term damage. Both of these issues can be very dangerous as they put athletes at a greater risk for further brain injury.